Good day, students. I am Sybil Fernandez, an assistant professor at Carmel College of Arts, Science and Commerce for Women New Goa. This module is for the 5th semester psychology students of TYBA. The paper code is PSD 102. Paper title is Health Psychology. It is a part of your second chapter, that is Lifestyle to Enhance Health and Prevent Illness. The name of the module is Interdisciplinary Perspective on Preventing Illness and Problems in Promoting Wellness. Module number is 6. The outline of the lecture is Interdisciplinary Perspective on Preventing Illness and Problems in Promoting Wellness. By the end of this module, you shall be able to describe the interdisciplinary perspectives on preventing illness and understand the various problems in promoting wellness. Starting with interdisciplinary perspectives on preventing illness. The advances in health in the current years have come about because of two avenues. The first one being efforts to prevent illness, and the second being improvements in medical diagnosis and treatment. Now, there are three approaches in illness prevention which can be understood with the help of tooth decay as an example. The first one is behavioral influence, wherein we try to promote brushing of teeth and flossing by demonstrating these techniques and providing information about them. The second will be environmental measures, wherein the healthcare system tries to treat the water. And the last is preventing medical efforts, wherein the dentists try to repair your cavities and remove calculus. Now, usually when we think of prevention, we think of it as something that takes place after a disease or an illness takes hold. But actually, there are three different types of prevention, out of which only one focuses on prevention before a disease takes place. Now, let us look at the three different types of prevention. The first one is primary prevention. This includes actions taken to avoid disease and injury, like a person who wears seat belts while driving or use helmets while riding, or who goes for regular dental checkups. Now, primary prevention can also begin before birth through genetic counseling, wherein genetic counselors can estimate the risk of a child inheriting a genetic disorder. It can continue after birth through vaccinations against diseases like polio, chickenpox, measles, etc. Medical professionals give health promotion advice. Now, this is one way wherein medical system can promote primary prevention, and the second being constructing websites on health promotion information. Moving on further, let us look at the secondary prevention. This includes actions which are taken to identify and treat an illness with the aim of stopping or reversing the problem. An example could be examination of the mouth for cancer during dental visits, BP measurements at malls, assessment of children's vision and hearing aid at schools. Also, another method would be complete physical examination of the body, which is done usually once a year. Moving on further, the third prevention is the tertiary prevention. This includes actions to contain or retard serious injury or disease progression during later stages when damage is usually lasting or reversible. Now, an example for this could be arthritis. People who have arthritis engage in physical therapy and continue taking their medication just to reduce the inflammation and the pain. For an incurable illness like cancer, the main goal would be just to make the person feel comfortable. Now, people who are suffering from disabling injuries may undergo long-term physical therapy to regain the use of their limbs. Next, let us look at problems that come about in promoting wellness. The process of preventing illness and injury can be thought of as operating as a system, which includes the person, his family, the healthcare systems, and the community. Now, Craig Egworth in the year 1991 said that many related factors and problems can impair the effectiveness of each component in the system, and each component in turn affects each other. Now let us look at what are these factors. The first factors are factors within the individual. Many people perceive some healthful behaviors as less appealing or convenient as compared to the other healthful behaviors. There are four factors within the individual that also play a very important role. The first one is adopting wellness lifestyles requires changing long-standing behaviors such as addictions which are difficult to modify. The second being people need to have certain cognitive resources such as the knowledge and skills on what health behaviors to adopt. Individuals also need sufficient self-efficacy regarding their ability to carry out the change. And the last, being sick or taking certain drugs can affect a people's mood and energy levels. Next being interpersonal factors. Now, there are many social factors that influence the likelihood of people engaging in health-related behaviors. In a study that was conducted by Homish and Leonard in 2008, found that one's partner's healthy behaviors before marriage can lead to his or her partner to adopt the same behavior over time. Also, people living in a family system may encounter problems in their efforts to promote wellness. An example could be a person who is trying to lose weight and therefore wants to engage into healthy eating, like she or he wants to avoid foods that are high in fat and cholesterol, while the other members in the family do not want to adopt this change and they continue having foods that are rich in fat and cholesterol like butter, eggs, red meats, etc. So it does become difficult to change your behavior. Next is factors in the community. People are more likely to adopt healthy behaviors when these are promoted by community organizations like our government or other healthcare systems. Redicke and Brunton in the year 1992 found that today's healthcare professionals are focused on the prevention of diseases rather than its cure. This was something that was missing in the past, wherein health professionals did not know about their patients' history, and therefore their major focus was on treatment rather than prevention. The problems that communities face in trying to prevent illness and injury are as follows. Having insufficient funds to carry on health projects or research. Also, in many communities, there is no proper place to exercise, no safe place to exercise. And some communities have a big number of restaurants which make it difficult to adopt a healthy behavior. Health insurance may not be covered in preventing medical services. The problem that communities face is trying to balance public health and economic priorities. An example to this could be, you are living in a community which has an industry which produces toxic substances, while on the other hand, there are many people from your community who are dependent on this industry for jobs and income. Now here there is a dilemma. If you want to close the industry, many people are going to be out of jobs. And there are many such dilemmas that many countries face around the world. With this, we come to the end of the module. Your book for reference is Health Psychology by Serafino. Thank you.